questions.
Thank you, Mr. Chairman. Thank you for being here. And I do want to echo some of what Mr. Nfume said, because I do think we need to focus on the people. And I think that's really what the angst that's left with the American people. It's what they had to walk through during this time. I'm going to go down a list of mitigation measures that you supported over the course of the pandemic and ask you just to give a yes or no as to whether you still believe these measures were justified. Business closures.
Not hearing you at all. Could you please speak louder?
Sure. I'm going to go through a list of COVID mitigation measures that you supported over the course of the pandemic and ask you to give me a yes or no as to whether you believe these measures were justified. Business closures.
Early on, when 5,000 people were dying a day, yes.
Church closures.
Same thing.
School closures.
Again, the
stay-at-home orders.
These were important when we were trying to stop the tsunami of deaths that were occurring early on. How long you kept them going is debatable.
Mask mandates for adults, mask mandates for children, mask mandates for children under 5.
And going back to what I said before, all of that is in the context of, at the time, 4,000 to 5,000
mandates for children under 5. There's scientific evidence for that.
Excuse me?
Mask mandates for children under 5. There's scientific evidence supporting that.
There was no study that did masks on kids before. You couldn't do the study. You had to respond to an epidemic that was killing 4,000 to 5,000 Americans per
Vaccine
day.
mandates for employees. Vaccine mandates for students. Vaccine mandates for military.
Vaccines save lives. It is very, very clear that vaccines have saved hundreds of thousands of Americans and millions
I'm not debating.
of people
We're talking about
worldwide.
the COVID-19. Did or do the vaccines, the COVID-19 vaccine, stop anyone from getting COVID?
I answered that question to the chairman. Early on, it became clear that
they did.
No, actually, no. In the beginning, it clearly prevented infection in a certain percentage of people, but the durability of its ability to prevent infection was not long. It was measured in months.
And they didn't stop you from spreading it either.
Early on, it did if it prevented infection, but what became clear that it did not prevent transmission when the ability to prevent infection waned.
I think what's troubling is when the American people look at the certainty and the case at which people lost jobs, they lost livelihoods. I had rural hospitals in my area that did not have a single case of COVID in their rural community that had to shut down and people not get care that they did need for cancer, and some passed away because of those kind of things. Time after time again, people's lives are destroyed, and we have not seen the same sort of, once the new data came available, we did not see a change of course. And you'll point out, for example, in the schools that the CDC, put out the guidelines, for example. But we know that those guidelines end up being protection from lawsuits. It's, if you don't want to be sued, you better follow the guidelines. So they're not mandates, de facto mandates, but they turn out to be such a mandate. And when the science began to change, we all understand that in the first couple of weeks, first few weeks, even a couple months, we were all trying to figure it out. I think there's a lot of grace for that. The concern is that as the science became available, there wasn't like a, oh, maybe we should consider the lab leak theory. Oh, maybe we should consider natural immunity. We never heard this messaging coming from you or from anyone else who stood on the sidelines talking about these things. And it's left the American people with a tremendous distrust. I want to talk a little bit about the grant process. My understanding from your testimony to us, it says that the NIH process for awarding grants is that basically research proposal goes to peer review committee to receive a priority score. Then it goes to an advisory council for NIH personnel. It receives a final, basically the group votes on it, and then eventually it ends up on your desk for signature, right? Now, you said in that sometimes, if I recall correctly, those grants are often approved in block, in mass, when they're voted on, and then you sign off on them.
That's correct.
This is one of the things that's really troubling to the American people, because they look at their lives being destroyed and there's no one to hold accountable, because these systems of of accountability have become systems of plausible deniability. And so your name is on every single grant, but yet you absolve yourself of any sort of responsibility by saying, well, you know, it goes to this committee that's, you know, that has a number of people on it, and they're approved en bloc, and so there's no accountability for anything, any of the taxpayer dollars that are going forth.
I disagree with you, Congressman, because if you look at the number of grants, we fund thousands of grants. It would be physically impossible for me to go through every single grant in a detailed way to understand it. That is true not only for me, but for virtually every institute at the NIH.
Then why does your signature go on it?
Because somebody has to sign off on it, and you trust the expertise and the competence of the staff that go over
Then what
it
is the
very
mechanism
carefully.
for holding
Gentleman's
people
time has
accountable?
expired. I now recognize Ms. Ross.